Former Australian Medical Association President Michael Gannon has written an open letter published in today's Australian newspaper to whoever takes over the AMA presidency later this month. And I'll tell you what, it makes for some pretty grim reading. He says Australia's entire health system is under threat, with general practice struggling, public hospitals underfunded, and the viability of private hospitals and the health insurers increasingly precarious. I'm pleased to say that Michael Gannon joins us live on Drive this afternoon. Dr. Gannon, welcome to the program.
Good afternoon, Ollie.
You've described the entire health system as being on a knife's edge. What do you believe is the biggest threat right now?
Look, I suppose in my article I referred to the things that I thought were really important 12 years ago, and they're still important now. And every element of those still faces significant threats. So there are certainly things that have improved over the years, but there are other pressures on the system that just make the great health system that we enjoy in this country face those threats. We could talk about any one of them, but I mean, right at the centre of our health system are our GPs. And for too long, they've been taken for granted. Now, none of us like putting our hands in our pockets, but the fact is that quality general practice costs money, and both sides of politics have been feeding the Australian politic on this fib, this fallacy that you can afford to provide the highest quality service with bulk billing. You can't. So let's stop telling those fibs. And again, I guess I took a platform I have with a regular contribution to the Australian to say to those people who are brave enough to put themselves forward for election, they know this, but this has to be right at the centre of their agenda. Of course, there's many other things they need to focus on as well.
Sure. Sticking with general practice, though, for a moment, Michael, has Medicare and the push towards bulk billing actually devalued general practice as a profession?
Oh, it certainly has. I mean, we had a really dreadful situation in recent years where we couldn't even fill the GP training program. So it had become that unattractive a career for medical students who had done their internship, had come out, and they're thinking about what are they going to do with their career. And we had a situation where we couldn't even fill the places. Now that was dreadful because GPs sit at the very centre of the health system. Now, specialists like me, we've got our skills in narrow areas, and that I'm not for 1 minute demeaning those skills. But the thing which sets the Australian health system apart from other comparable health systems is the enormous value we get out of GPs and how much they do in terms of managing chronic disease, managing all sorts of problems without need for referral to hospitals, to other specialists for expensive tests. They are the experts in hospital avoidance. They are the experts in managing chronic disease. Of course, other doctors get involved where necessary.
You say that public hospitals are $9.6 billion short of what they need. What does that underfunding actually mean for a patient walking into an emergency department today, Dr. Gannon?
Well, it means that whether they've worked it out or they haven't worked it out, their care is rationed. So they might have waited 8 hours to be seen in an emergency department. They might have waited more than 24 hours. Sometimes those waits are dangerous and will have a negative impact on that outcome. They might have waited months, if not years, for an outpatient appointment in one of our public hospitals. They might have waited months, if not years, for elective surgery. Governments, state and federal, both sides of politics, it's very hard for them to acknowledge the failings of their hospitals, but instead of blaming each other, they could try and work together. And instead of blaming doctors for problems in the system, they could work with them. Now, I went into the AMA presidency very optimistic about what I could achieve with our political leaders, and there was some from column A, there was some from column B. There were people who were great partners who really wanted to improve the system. There were others who were indifferent. There are others who were incapable of making those changes. But I think that it's so important that everyone who's got a stake in the system works together, because if we've all got a stake in it, we're all patients one day. Every one of us has someone who we care about who's going to have an intersection with the health system in the coming days, weeks or months.
My guest is Dr. Michael Gannon, obviously Perth-based obstetrician and the former president of the Australian Medical Association. He's penned a letter in the Australian newspaper with a couple of pieces of advice for whoever becomes the next president and vice president of the AMA, identifying 4 pillars: primary care, public hospitals, which we've just spoken about, soon private system and prevention. But look, if you'd like to have your say, 1300 22 1025, because you're on Drive with Oliver Peterson on 102.5 ABC Perth and WAs. We're broadcasting right across Western Australia this Thursday afternoon. And do you feel as though Australia's health system is getting harder to navigate? Bring to me your personal stories, your interactions with our health system, 1300 22 1025. Dr. Gannon, as I said, there's then the private system. Healthscope obviously collapsed. Ramsay's under financial and operational pressure. How serious is that threat, and what happens to the public system if the private system starts to unravel?
Well, people in Western Australia might not have had a first-hand view of Healthscope. Healthscope only owned one private hospital in Western Australia. That was the Mount Hospital in the city. But they were Australia's biggest private hospital operator. Just to show just how unviable this business has become, the receivers of Healthscope are struggling to sell a number of the hospitals. Now, obviously, there are some attractive units in certain parts of Australia, but there are other ones where they just can't sell them. So that's a real concern for that business.
Yeah.
Equally, the private health insurers, they are very much marginal businesses. Now, anyone who wants to look at the financial affairs of the for-profit providers like Medibank Private, that's publicly available information. Obviously, a lot of us are insured by mutuals, so insurance companies that we collectively own, like HIF, like HBF. All of those organisations are run very tightly, and obviously they're key players in the private system. If the private system collapses, the public system, it just simply can't. It simply can't cope. The overwhelming majority of hip replacements, knee replacements, colonoscopies, cataract surgeries, any operation you care to name in Western Australia are done in private hospitals. More and more people are choosing to pay out of pocket without health insurance to have their treatment in private hospitals because they can't stomach the wait for care, or they're getting sick. So whoever takes on the role of the AMA has a job to help navigate this system. They have to work with the insurance companies, with the hospital operators, with the doctors who work in private hospitals, and they also need to work especially with the federal government, who exerts a lot of control about how this system works. Now, the state governments know how important the private system is, but they've got less control over how that runs. But the Commonwealth government does have control of this. And I suppose that the decision which sticks in the craw of a lot of us that's happened only in recent months is that the Albanese government, Minister Mark Butler, has decided to take away the private health insurance rebate for over 65s. Now, you know very well, Ollie, that a lot of people who hold private insurance, it's not the top end of town. It's people who value their health, the people who they might have a chronic disease and they know how important the private system is. It's simply not fair on them, and it makes no sense to attack the private system at a time when it's under threat and the public system's already straining under the burden of those who can't afford to have care in the private system.
Finally, Dr. Gannon, you've been the AMA president yourself, and you described the role as involving significant personal sacrifice but being, quote, breathtakingly rewarding. So why is it still worth taking on when there are limits to what the president can actually achieve? And what do you want that next AMA president to be able to do differently?
Oh, look, I think you can only do what you can do. I made reference in my article to the fact that, there are things I wish I could have done better. You're really up against it, but it's so important that the organisation that represents Australia's doctors continues its proud role of advocating on behalf of our patients. The system we work in is sometimes very cruel to patients. It's always been hard to navigate, but it just gets harder and harder. So there's things that we try hard to do as individual doctors to take care of our patients. What I saw was the ability to take care of patients at a population level. So I've congratulated those 5 or 6 individuals who have put themselves forward for leadership positions. It takes courage. They're going to give up a lot. They will learn a lot about themselves. I hope that the successful candidates regard it as a positive experience. They shouldn't underestimate the sacrifices they'll make, but it's a really important role. The AMA has consistently made this country a better and a healthier place. I hope that role continues.
Dr. Gannon, thank you very much for your time.